modern medicine is to a large extent about pills. And a lot of patients talk about moving beyond pills. What is your take on that?
Inputs from services, which could even be forget medicine, forget pills, even some so-called psychotherapies or whatever we may be doing, together may be contributing to only 11%, even perhaps in mental health, and 40% is by this own individual. So why are we not making sure that this is strengthened? One of our study in opiate addiction, you give yoga and you don't give yoga, the addiction related withdrawal symptoms is much lesser when you give yoga than you don't give yoga. One of the herbal agents reduced weight in individuals who are on antipsychotic drugs.
Okay. How do you think both these traditional sciences can complement the modern medicine treatment?
So together, whether Ayurveda or yoga, the essential principle is to empower the person. And if a person cannot be empowered and he has to depend on only the external agent that the doctors have to be giving it to him, it is not a total treatment package. A person himself is a very good healer for himself or herself.
Welcome to the 10th episode of Mental Health with Dr. Harkishan Mamtani. In the previous episode, we spoke to Professor Chakrabarti, a hemat-oncologist, about the mental health aspects of cancer. That episode has received a great response. So if you know anyone who has been recently diagnosed with cancer and is fighting that battle, do share that episode with them. These conversations remind us that mental health is not just dictated by one factor. In fact, mental health is determined by a lot of other factors surrounding it, like physical illnesses or traditional sciences or even cultural wisdom. In that spirit, we decided to speak about the role of yoga and Ayurveda in mental well-being. Research is increasingly showing that both of these traditional Indian sciences have shown a good result in ensuring a good holistic health of an individual. To explore this intersection of tradition and science, we were more than privileged to be joined by Padmashri Professor B.N. Gangadhar sir. Professor B.N. Gangadhar sir is the Professor Emeritus at NIMHANS Bangalore, where he has also served in the capacity of the Director. He also served as the Chairman of the National Medical Commission. Professor B.N. Gangadhar sir has decades of experience in research and clinical expertise in the field of mental health, and he's one of the pioneers to integrate yoga and Ayurveda in mental health. So let's hear it out from him, how yoga and Ayurveda can help one's mental health in their day-to-day lives. Let's dive into this interesting conversation. Hello everyone. Welcome to this very special episode of Mental Health with Dr. Harkishan Mamtani. As we are joined by Professor B.N. Gangadhar today, one of my teachers at NIMHANS Bangalore and someone who continues to inspire a lot of young doctors like me. In fact, generations of doctors, if I can say that, sir. So, sir is a pioneer of integrated medicine, integrated psychiatry here in India. So, we thought of discussing with sir about integrative psychiatry in general. What are your opening remarks about this, sir?
At the outset, medicine practice is integrative. We don't depend on just one medicine. We include several other interventions, diet, behavior, lifestyle. So is the case with psychiatry. In fact, psychiatry has been practicing it even more religiously because practice of psychiatry involves many other co-partners, psychologists, social workers, and we don't work without them. So I believe medical practice is an integrative practice. There's nothing to be called as integrative medicine separately. But in the recent days, of course, application of traditional systems of healthcare has been considered as a part of integration into the modern medicine. But I believe all systems that will help a person for his well-being should be integrated in terms of healthcare, not remain isolated to just one application.
Right, sir. That's indeed very true, sir. Because when we look at patients, it's not just one thing that helps them. It is a holistic improvement that everybody is looking forward to. But sir, what inspired you to bring these worlds together? The world of, let's say, psychiatry from the modern medicine perspective and yoga and Ayurveda into it, sir.
Yeah, firstly, it's important that Indian knowledge systems have to be exploited thoroughly. Whichever branch of application we have, not just medicine, perhaps in many other branches, Indian knowledge systems have an important role to play.
Right, sir.
Having said this, in the medicine, Ayurveda, Yoga, and in the southern parts of the country, Siddha have played a very important role in maintaining health. And till the colonial rule, we have never heard of the so-called allopathic or modern systems of medicine. With these three approaches of yoga, Siddha and Ayurveda, I think health system was very well networked, and these are formal educative medical resources that we had, and they looked after the health of the society.
Right.
And forget within the country, even in the world, the allopathic tradition has only about 150 or 200 years history. We say we almost a couple of millennia, some health system has been regularly practiced. This is first part of it.
Right.
So a pride on knowing that we had a traditional system which was the backbone of the healthcare in the entire country is something that is very important to invoke. I think that perhaps happened to many of us and happened to me also. So this is one part of it. And when I went on to study some components, if not all, I realized that they had given a very good strength to our healthcare systems. And I think the good parts of those have to be brought back. So, although, of course, in India, it is still vogue, it is still in practice, still it is being used, but somehow allopaths or they both think that we work exclusively. So this exclusivity has to go away, it has to be inclusive. And over time, I also realized that an average patient has a pluralistic choice. Average patient seeks out systems in 2 or 3 areas actually. He could well be practicing some home remedy with the aunt or the grandmother or the mother tells him to follow this pathya, or eat this or don't eat this. Or he may still be taking a Chavanaparash or some of those things for his well-being, and he may still take your paracetamol or whatever medicine that you want to give him because he has got a fever or cold. So I think pluralistic choice is inherent in our system. But how to recognize that, respect that, and respect that inclusivity rather than being exclusive. This or that should be replaced by this and the judicious that as well. So this brought me to looking at the traditional systems of healthcare to be blended with the existing system for the best outcome.
At what point of time in your career, sir, did you start to explore these, sir?
It's difficult to say. Maybe it was there all along. Traditional systems of healthcare to be included maybe about 25 years ago when we started reading many of these things, and people told us that these should be examined, and then it started at about 25, let's say early 2000.
Okay, so that has been some time since you've been studying this, sir. So, I mean, this was out of your personal interest, sir, or more like a scientific curiosity, sir?
Like I told you, this is all there, but I, being scientific in my temperament all along, I put them into the scientific questioning mode. And that's how it evolved. And as we went on questioning, the truth only convinced me over course of time that integration has to happen. The research that we did and the experiences of the patients, all put together, I think it has come to stay and it is going to stay.
Yeah, that's a very promising statement that you're making. We'll talk about the research as we move ahead in this conversation, sir. But one thing which I have noticed, I have seen, and in fact, this is the perception of a large number of patients as well, that we see that modern medicine is to a large extent about pills. And a lot of patients talk about moving beyond pills. What is your take on that, sir?
Okay, I must say, we are talking about psychiatry.
Right, sir.
Now, when it comes to psychiatry, pill is one of the inputs, is what we have been taught right from the day of our psychiatry education. We are told that there are a lot more things that have to be done other than the pills, and which include various psychological interventions, various social interventions with the family, and various personal interventions of his own self-care. In fact, it might surprise you if you do a search on any standard today so-called AI platforms. If you say what contributes to health and what contributes to health by what percentage, if you see health care services inputs, it accounts for 11% of what you would get for giving you a good health. Whereas self-participation and self-discipline, self-lifestyle, etc. contributes to as much as about 40%.
That's a huge.
So, which means your inputs from services, which could even be forget medicine, forget pills, even some so-called psychotherapies or whatever we may be doing, together may be contributing to only 11%, even perhaps in mental health, and 40% is by this own individual. So, why are we not making sure that this is strengthened? And this is something that I think we have to do a introspection. A person himself is a very good healer for himself or herself. And if we can recognize that and if we can strengthen that, is very important. So pill is one of the ingredients. I am definitely not belittling the role of a pill.
Yes, sir.
But I think pill always has its role, but then there are roles perhaps even stronger of many other interventions which we have to examine. And in fact, you ask a contemporary psychiatry, an average psychiatrist today, who is, let's say, about 30-40 years of profession in psychiatry, they all feel that once upon a time, when 30 years, 3 or 4 decades ago, we were using several interventions such as psychotherapies and family therapies, interventions of various therapy mechanisms, there is schools of therapy. Right. But today, most psychiatrists may be using only pills, that's what they say. And your answer, your question, pill is not the only answer, which is also true. Pill is one of the answers. I don't want to say it is not an answer. It is definitely one of the answers. But then there are other answers that we have not put them into use.
Right. But sir, we are talking of traditional sciences, things that have been there for centuries now. How relevant do you think they are in the modern times today, sir?
Okay. Mental health or the mind, understanding of the mind, has been there from age immemorial. Everybody has explored as to how to understand and how to explain mind and its deviations. And I do not want to say that all insights came only in the last 1 or 2 centuries. I'm sure people must have attempted understanding the mind.
Yeah.
In fact, you go through any of the traditional literature, not just in our country, you go on to any other country, it talks about how to understand oneself, which is the central principle of any psychological intervention. Apart from people who have a very serious psychotic illness, But in most other conditions, understanding oneself could give you answers as to how to overcome those pitfalls that you have and who gotten into this difficulty. So having said that, traditional health science in mental health perhaps has laid a very strong foundation of learning and understanding ourselves.
Right.
And we need to look at different schools of thoughts, different schools of intervention, different schools of approaches, different schools of lifestyles, which will strengthen this concept of understanding oneself and making sure that you correct and make sure that your mind is in the right path. Whether we talk of the Bhagavad Gita those days or today modern various therapies, all lead to you fine-tuning your own mind for well-being. So that naturally leads us to investigating traditional systems of healthcare in psychiatric practice.
Right. When you speak of investigating these traditional systems, I think you've been an avid researcher and your numbers speak for themselves. So what is your experience? Let's say you spoke of traditional sciences. Let's talk of yoga first, sir. So you're experiencing about researching for yoga in the common mental health issues that we see nowadays.
See, yoga is actually a lifestyle. It's a spiritual lifestyle. It's nobody wrote yoga for the purposes of treating rogas. But it is a side benefit that you will get. When you practice yoga, the purpose is for your well-being and for the transcendence beyond that mere well-being. Union of my personal self with that conscious of the cosmic nature. So this is the transcendence, the so-called samadhi that you're going to achieve. But the point is, in the process of moving towards this connectedness to that cosmic consciousness, you will start getting several benefits, physical and mental health benefits. Body becomes more flexible, body has more strength, is able to balance better, and it's able to perhaps fight for various other diseases, and chronic aches and pains starts coming down, and stress starts coming down. Stress related my psychological distress starts coming down. I may be able to combat psychiatric illness if I have any, and it will build more resilience into me, both physical and mental resilience. It will start building into me. It will promote those biological changes which are again conducive to keeping me fit and even better fit than what I am. And I'm able to withstand various other stresses that come in. And that resilience I build. So put together, this is what it is yoga expected to do and happen if you continue to practice. But you don't practice it for this purpose. You are going to practice it for that ultimate spiritual transcendence. But while that is going on, when that is happening, these I don't want to use the word side effects. Side effects usually is a pejorative, but the side effects of yoga are generally positive. This is not what you wanted it to happen, but it happens. So we as physicians take those early benefits of yoga, which are beneficial to the health, and translate it to our patient care. So this happened largely because of my own interest in practicing yoga, although my practicing of yoga was merely because many people were practicing along with me in the schools and in other places. I also practiced yoga. And when I continued to practice yoga, that became something I felt good about it. That's about it. In the college days and early my medical profession. But only when I started reading about and the literature started coming out, I realized whatever I had, the benefit probably has a base. And if I can benefit from yoga, why not my patient benefit from yoga? So this is a cascaded into applying yoga in clinical practice.
And I'm sure, that would have had positive results on your patients as well, sir.
Yeah, like I told you mentioned common mental illnesses.
Yeah.
I can illustrate yoga practice and its benefits in some 2-3 conditions. But let's say a common condition today is the depression. Depression, you practice yoga, depression comes down. It's not just our literature, our study that we have done at NIMHANS. There are many people who have done elsewhere also. And depressive symptoms come down. And people have even demonstrated yoga being the only treatment and without even medicines. There are the clinical trials, randomized clinical trials have shown that significant improvement in depressive symptom scores happen when yoga is introduced than being waitlisted. Nothing else was given. Now, of course, most literature has happened with studies where patients have been taking medicines and yoga was not added. But in any case, yoga addition or yoga being alone has significant antidepressant effects. This is number one.
Right.
Now, so much so, this has influenced a couple of what you may call as treatment guidelines to include yoga as a part of treatment in the treatment armamentarium of treating depression. Just as much we say psychotherapy should be used, cognitive behavior therapy should be used, exercise should be recommended. Addition to whatever medicines do, the pills do, if you want to recommend something else, recommend yoga. Culturally accepted in our country, more easy to practice, and more people are familiar with yoga and they can practice indoors as well. You don't have to necessarily go, and you don't need another therapist to be available all the time. You learn in the initial few days many things that you can continue to practice. So number one, depression treatment with yoga, there is a case. There are other conditions which we may call as common mental disorders, like somatoform pain disorder. I'm giving an example. Yoga benefited. Obsessive compulsive disorder. Yoga are waitlisted individual who both of them getting standard treatment for given by the allopaths, the medicines. You give them that yoga practitioners, yoga therapy people get much lower scores on their obsessive compulsive measurements than those who did not get yoga. Although they received both antidepressant or the standard medicine that they would have prescribed for obsessive compulsive disorder. And I can go on to share many such examples, not just these conditions where common mental disorders have benefited. Memory symptoms in elderly, what we may call as mild cognitive impairment, insomnia, childhood conditions such as ADHD have benefited. Substance use disorders have benefited. Very recently, one of our study in opiate addiction. You give yoga and you don't give yoga, the addiction related withdrawal symptoms is much lesser when you give yoga than you don't give yoga. They recover from the withdrawal effects faster, and then of course subsequent cascade of events of keeping them abstinent can happen. So in effect, yoga practices have had positive influence on most of the common psychiatric disorders. Why common? Why not serious disorders? The schizophrenia, for example, it's one of the severe mental disorders we call it. Although it is not a very common condition, but it affects early, continuous, lifelong for many people, and it in fact even pulls them down as they keep moving into getting better. Medicines have definitely a good place getting them better, but it won't sustain. And even if it sustains, it leaves a scar, not the medicine, but the illness leaves a scar in the individual, what we call as negative syndrome. Negative syndrome is person being motivated, not being with the family, disconnected, not being responsible to earn, and a wide spectrum of conditions, which again no medicine has really made a mark on those conditions. Introduce yoga in addition to ongoing antipsychotic medicines for these people in the outpatient itself. There is a significant reduction in the negative symptom score, which will happen. And like a patient's mother telling me that almost 8-9 months of yoga practice to her son, she said, now doctor, I have got my son back. When I say, what do you mean you have got my son back? He was always with you. No, he's now what he was earlier. He emotes with me. He brings some vegetables home. He takes me to a temple, takes me out for shopping. And on my birthday, he remembers to bring the sweet I used to like. The color of the dress, he brought a new saree of the same color. All these things weren't happening before. Although he was he was less psychotic, was at home, was not troubling me. But more coming closer to me and getting himself the usual picture happened after the yoga has been practiced. So in schizophrenia, severe mental disorders, yoga has a role. So in effect, like we integrate people in our therapy with psychological intervention, psychosocial intervention, I think time has come now to integrate yoga as a part of our treatment armamentarium into routine clinical practice. A mental health team, by definition, is a psychiatrist, psychologist, social worker, and in the hospital, psychiatric nurses. Whereas in the outpatient care, psychologist, social worker, and psychiatrist form the team. Now, I think we should include a yoga teacher or a yoga therapist or a yoga professional also into the team of mental health care. Then we would probably be able to give a much global perspective or a much holistic perspective to his clinical outcome.
No, I think it's very promising from what you're telling, sir.
Yeah.
You spoke of a range of conditions. I mean, if I were to talk of the spectrum, then it is like ADHD in childhood to mild cognitive impairment in the elderly, and across conditions, be it depression, OCD. You spoke of all these conditions where yoga actually helps. So it definitely calls for us integrating a yoga therapist.
Published papers and done with reasonably good research rigor to matter in our clinical application.
Yeah, that's indeed very promising, sir. But you also mentioned about certain biological changes that yoga brings about, which are conducive to mental well-being. Are these things which are like scientifically measurable so that the audience can understand that these are the changes that happen because of yoga that can contribute to mental well-being, sir?
Yeah, you see, I can give you some examples of that.
Yeah.
Now, under stress, our body releases what is called as cortisol, a hormone. It's called as a stress hormone itself. I become stressed whenever I am depressed. The stress causes depression, or the depressive thoughts causes stress. We can go on debating.
Yeah.
But stress produces depression or associated with depression, and stress leads to release of a hormone called as cortisol. Cortisol is there in the body, it is released, so what is the big deal? And that the body, it is being released and levels become higher and remain higher for a long period when the depression remains untreated is a source of concern, because it's a cascading effects of the stress hormone are there on the body, starting from your blood sugar, blood pressure, cholesterol, and a host of those things. The bones become weaker, a host of those things can happen. And in the brain also, it will have an impact. Cholesterol has an impact in the brain. For example, it will reduce the functioning of what is called as the brain-derived neurotropic factor, a repair material in the brain, which is released to ensure that my brain's wear and tear is continued. It doesn't happen, and then continuous repair keeps happening.
Yeah.
Now, if you see in people with depression, cortisol levels are higher, and the brain-derived neurotropic factor levels are lower. You give them treatment, it is expected to get better, both, but not always so. But if you give yoga, the cortisol levels come down in people, and the brain-derived neurotropic factor levels go up. This has been demonstrated in a couple of experiments at NIMHANS in healthy individuals, and also in vitro experiments. The cells of the individual's blood who has a depression and who was treated later on with yoga, the cell is much more resilient to any toxic effect when a person has been already exposed to yoga. These experiments have happened, but in the nutshell, yoga prevents stress. And how does it prevent stress? Some of the components of yoga have this stress reducing biological mechanism. Your stress occurs because you become emotional. The emotions are driven by what we call as the limbic gray matter. And this limbic gray matter hyperactivity and stress happens. And you practice yoga. One of the ingredients of yoga, for example, chanting Om, it actually deactivates these nuclei. So Om chanting deactivates this nuclei, and because these nuclei are less active, the hypothalamo-pituitary system is now subdued, and stress effects biologically are prevented, and the body now gets more repair mechanisms activated, and body is well. So that's why in Hindi, in Sanskrit, it says, Chita dahati nirjeevam, chinta dahati jeevanam. So you are being continuously stressed, worried, preoccupied, you could lose your own gray matter. And in fact, it is shown in healthy individuals who are not practicing yoga, there is a age-dependent drop in the gray matter in your brain. And this age-dependent drop is perhaps mitigated, stunted, if you have been continuously practicing yoga. In chronic yoga people, this age-dependent decline in the gray matter has been shown to be not so much steep. It is there, but it is more protected. So in other words, yoga practice has benefits. And today we have seen, even in chronically ill schizophrenia individuals, practicing yoga reverses some brain changes that have happened because of the illness. Illness makes many of the circuits becoming disconnected. Yoga connects, as we say, cosmic consciousness to my personal consciousness. So this connect may also be reflected in a biological connect. And yoga makes the circuits inside the brain more coherent. And it has been demonstrated. And in this process, their schizophrenia symptoms also get better. So put together, there is evidence clinically, there is evidence biologically that yoga has been producing changes positively, conducive to a person getting better. And so I think we should use yoga. The benefits which it gives should not be lost out to the patient, because I personally may or may not have faith in yoga. That should not be the reason. It's demonstrated, and if somebody has an option to get yoga, I think that should be recommended and offered. When I'm saying yoga, it is not just one yoga procedure for every disease. There are researches that have happened that there are some yoga practices are better for one disease and some yoga practices are better for another disease. And sometimes you don't want to add meditation, but you may want to do the yoga practices in a mindful way. So there are specific yoga modules that have been created for different diseases today. And it may be useful to adopt one of those modules for each of the condition for which you are recommending yoga. And these are all generic modules. So anybody who has had some training in yoga practice should be able to teach them.
I myself have seen these modules being applied to a lot of patients while I was there at NIMHANS, and the results were indeed very promising, sir. But sir, I mean, there's one common misconception that people have. Like they say that yoga is all about those physical postures, what we call asanas. So I believe there's a concept of Ashtanga yoga. There are various
like
other
I
elements.
told you, that when we are talking of yoga, it is not just one posture, physical activity. Yoga is more than physical activity. Or let's not say more or less than physical activity. Yoga is of course a physical activity, one component. Then there are component of your moral lifestyle, which is talk of the yama and the niyama. And then you have the asanas, and then you have the pranayama, control on your breath. Then your pratyahara, again minding yourself, your business, and making sure that you select what you have to receive and filter what you don't want to receive. And then you'll be able to be consistently applying your mind, being mindful, and continue to apply mindful both actively, and that should become a part of your style. That is the dharana, and then that should become dhyana, and then that will eventually conclude into your state of samadhi, which will be the transcendence that you will reach. So there are multiple dimensions in which you start acting when you are practicing. Like I said, it's a lifestyle. Although these are all practices, the Bhagavad Gita says there are some more, which include moderation in your activities. Yuktahara viharasya, yukta cheshtasya karmasu, yukta swapnava bodhasya, yogo bhavati dukkha. If you have to reduce your suffering, practice all these moderations in your day-to-day activity, and that is yoga. So not just the asanas. Asanas is one part of it. But then there are many other components. You have to see what is the best for an individual. In fact, yoga is something like a meal. And that meal, you can have a North Indian dish, a South Indian dish, a dish which you don't want with oil, without oil. So you can tailor the yoga for your own self and make sure that you feel fit at the end of the yoga practice.
No, I think the way you're talking, sir, it is hard to believe that not many people from modern medicine are this aware of the intricacies of something like yoga, sir. And it is really good to know that, and it's really good. I'm sure this is going to benefit the audience at large, sir. But where do you think yoga stands against mindfulness or meditation? I mean, these are very commonly advocated practices.
Yeah, like, when we say yoga and meditation, yoga is meditation.
Right.
Because when you are doing yoga, if you are not mindful of the entire thing, then it's not yoga at all.
Right.
Then it becomes just a physical movement. So, in fact, very recently a publication has come with, just today morning I saw it on my cell phone. Mindful walking produces very good effects in terms of mental health. That means mindfulness in our activities is the central issue. So mindfulness cannot be separated and sold as one element. It's true. Mindfulness has a significant impact. That you do mindfully most activities, that itself is yoga actually. So we make it an hour's practice of mindful asanas, and all these things cannot be separated. They are all together. They all go together as a single package.
Right. So it's not like a versus thing. It's very much
everything is inclusive. You separate, make it exclusive, then you lose the benefit.
Right. Let's I mean, we've spoken at depth about yoga, sir. Let's discuss a little bit about Ayurveda, sir. So this morning when I was researching a bit, I came across this shloka, which is like the aim of Ayurveda. It says that swasthasya swastha rakshanam aturasya vikar prashmanancha, which means that the principle of Ayurveda is to just protect the health of the healthy individuals and also to treat the ailments in the unhealthy ones. In this background, sir, I mean, this is somewhat in lines with what we in modern medicine read in preventive and social medicine. But sir, what is your take on this?
Yeah, it's true that Indian systems of medicine are essentially spiritual.
Yeah.
When I say spiritual, means atmaiva atmana bandhuhu. That is, you yourself are the person who can bring you out of suffering.
Yeah.
So it has to stand. This is what is said in the Bhagavad Gita, and then you go on. So you can be a friend or a foe to yourself. Be a friend. And to be a friend, what are the things that you have to get it? You have to be empowered. Empowering happens by way of the medical people who are knowledgeable about health and illness. So they are going to help you to empower yourself by way of moderating your diet, making sure the diet in the right season, for the right person, the right diet for the right illness, and some of the natural products as treatments at the first level, second level, and third level of your interventions, and practices of lifestyle which will also empower you to build resilience, yoga, exercise, pranayama. So together, whether Ayurveda or Yoga, the essential principle is to empower the person. And if a person cannot be empowered and he has to depend on only the external agent that the doctors have to be giving it to him, it is not a total treatment package. So how do you empower him? Not just giving a medicine, but I think empower all other resources that he can pool together and pull together to be able to himself to remain fit. More fitness, the less illness.
I think that kind of summarizes the essence of Ayurveda or the traditional practices in general. But when we talk of Ayurveda, I am reminded of one very interesting discussion that I had with Professor Shivaram Varambali back at NIMHANS. He told me that a lot of patients, come to us in our practice and they tell us that, Doctor, what is the restrictions in my eating habits that I should be practicing? So he said, as modern medicine practitioners, we do not have answers to that, but Ayurveda does give answers to that.
We not that modern medicine people don't have at all, but have a limited answer. We usually are not taught formally in our education that with this medicine, this for this illness, that for diet, not been taught. So Ayurveda has a much different role. Not only the person, his doshas, his gunas, and his the illness, based on all these things together, and his age and the season in which he has to be eating what. So there are many elements that go together when recommending a diet to the individual. And it is much more formal. And most mothers know that actually. They know what to do to mitigate illnesses because of various vagaries. But somehow we have left it out. And today, medicine has become the food. Food could have been the medicine. So in essence, Pathya, which is taught in Ayurveda, has to be little more formalized and put as an ingredient in our modern systems of healthcare, which will be very complementary to whatever treatment that you are giving.
So, essentially you spoke of the diet specific to certain seasons, and that is what is coming under the principle of Ritucharya in Ayurveda. Which of these dietary changes or season related changes or routine related changes in Ayurveda are important for mental well-being, sir?
Like I already said, which is the same thing, moderation in your diet, moderation in your physical activity, which includes sleep and rest of the physical activity, and moderation in your thought processes, how much you indulge in various emotional thoughts, non-emotional thoughts, worries, and so on and so forth. All these aspects are very important in Ayurveda, which Ayurveda also talks about it. So, right food, right sleep, right exercise, right intellectual involvement of your thought processes, and of course, avoid all the wrongs, which will, in summary, makes you keep fit. And for this, Ayurveda has given a big list of things. And when things go out of order, in spite of all these things, they go out of order, there are, of course, some herbs they still use. But that would be the last step.
Right.
Or that would be the step if the person has already become ill. But if he has been practicing all these things, the chances that he would slide down to illness could perhaps be lesser.
Right.
This is what Ayurveda has said. But today, modern scientists say that has it been demonstrated in an RCT. So, RCT seems to be the buzzword now, which of course I believe as a scientist, RCT for any new introduction. But this is not what is a new introduction. This has been there existing all along. Should something that has come as a long history of experience, should it be now put to an experiment for its validation, is an issue that we can go on debating. I believe what has come as an experience and has stayed for centuries, experimenting is a different issue. You can go on to experiment, but you don't have to wait for the experiment to get the benefit of the experience into clinical practice.
Right. Sir, I mean, like you said, a lot of us fellow modern medicine practitioners, they question the scientific basis of Ayurveda, sir.
That's what I'm saying. That's why I said Ayurveda came into practice perhaps and has remained in practice for various reasons. One, of course, it's likely that people have accepted that it is working experience. They must have cleaned it and de-weeded it so that retain only what is useful. What is useless must have been removed. Over the centuries, it must have happened. Just as much as over the course of last 100, 200 years, we have also removed many of the medicines which were either not working or causing side effects, etc. So in psychiatry itself, we have seen, we have removed, in fact, some medicines are not even heard today. Although in the 40 years back when I joined medicine, psychiatry, I used to write those medicines. Today we are not writing because we think that they are more side effect producing. So this de-weeding, if it can happen in 40 years, in the 4,000 years, I'm sure more de-weeding would have happened in them also. So Ayurveda would have been now given in a cleaned scenario. I'm not saying that it does not require any more research. Yes, you should continue advanced research, use advanced tools, but you don't have to necessarily wait for evidence from experimental tools to accept what experience has given us. Now, if you put all these experiments into practice, even this experience can be fine-tuned to a better thing. I'm not saying that at all. But you don't have to say, having not done this, it is useless. But I think there is a scope to make it even more useful if you put these things together. So I believe the saying says, old roots and the new sprouts. We need to respect both. So I think we can always get better sprouts by making sure modern methods of farming, but the old roots remains. So in effect, we have a lot to learn in India in particular, since science has advanced so much and we have the traditional knowledge bank. If we can hybridize these two things, the output can be much, much more than what it is. And more so, the society now all along has been accepting the old roots. So it is just that we need to fine-tune it if required, and if we can with our experiments, fine-tune it for a better thing, rather than saying that it is useless even before we did that. So testing old systems with new research methods can be difficult. There's not one product, chlorpromazine or risperidone, one molecule you are going to test. It's perhaps a mix of many molecules which you are giving in an herb. So it's a challenging risk that you have to do, and particularly when it comes to yoga or any other physical method of intervention, getting an appropriate what we call as placebo is going to be different. There are challenges. Not that challenges should deter us. Continue researching. There are many other ways of researching on older medicine knowledge, and I'm sure we will have better answers in the days to come.
Right. But speaking of research, sir, like you enlisted for yoga, does Ayurveda also have a significant role in psychiatric conditions?
Just recently, just about a week ago, in Ayurveda, they have published one paper. It's a case series though. One of the herbal agents reduced weight in individuals who are on antipsychotic drugs. So I may not be fully aware of all other research that has happened in Ayurveda. Since I read it just a couple of weeks ago, I can only say there are scope for research and a scope for changing this in Ayurveda literature as well.
Right, sir. So, I mean, from what you're telling me for the last half an hour that we've been discussing things, it sounds like both Ayurveda and yoga can have a promising role in treatment of an individual with mental health issues. How do you think both these traditional sciences can complement the modern medicine treatments and not replace them? I mean,
this word replace may not be the right word. Many things have replaced our modern medicine in West also. Psychotherapies have replaced. And many people I don't want medicine, I want only treatment. Particularly in children, they don't want. So these are all issues are there. So I don't want the word replace. Replace may look a little pejorative, like throwing out somebody. No, I'm not saying that. I think the full benefits of traditional systems of medicine should not be lost out to the patient.
Yeah.
Offer it, and where it is possible, judiciously combine with your medicine. Where it can be given alone, also we should give a try with that. And many people want it also today. So put together, it's possible that some people, like ECT was replaced by many other treatments. It can happen. And vice versa also can happen. ECT did, of course, replace many other treatments that were being earlier given. So both can happen. My treatment can replace your treatment and vice versa. But what is important is not you or me is important, but that patient is very important. So if we keep patient-centric mindset in our approaches in clinical practice, I'm sure we will respect all systems of healthcare equally and make sure what best way in which we can put them together for our patient care.
Right, sir. Do you see integrated medicine practice becoming like a mainstream practice here in India and possibly even globally, sir?
I'm hopeful. At least as you can see, all the aims have now got a section of integrative medicine. They have an Ayurveda, Yoga wing in all aims today. So if this can happen in such national institutes, many institutes, even private, many medical colleges, I am aware, having a yoga section. So I'm sure it is inching towards that.
Right.
Can it happen faster? Yes, I would wish it can happen faster. And why it can happen faster and who can help it? It is only us as medical practitioners can make sure that it happen. And in India, Indian systems of knowledge need to be brought up, regarded, respected, and integrated into healthcare service.
Yeah. I mean, let's hope that day is not very far away.
It will happen. It will happen. I think we are all aware of it. It will happen. I'm very optimistic that the people will look at things more dispassionately and be able to put them together.
Yeah. But, sir, I mean, you would have given such talks at a lot of places to your peers in medicine. What are some of the common challenges that you face while, talking to them about the effects, the positive effects of yoga and Ayurveda?
Till now, for whatever the reason, the way in which I present or the evidence that are available, questions haven't come up. But there are, of course, people do raise this question. You can always belittle any research for that matter, which can happen at some time. The loopholes can be identified and to reject the hypothesis. But at the same time, how open are we is the question. I don't want a very fanatical protagonist of traditional systems of treatment without questioning. Same time, question and always reject. That also need not happen. Question, find the answer, refine, improve, keep moving. And I am optimistic. In the last 20 years, I've been lecturing on different places. On day by day, the interest and approaches have gotten better. Very recently, the World Psychiatric Association in liaison with the Indian Psychiatric Society conducted a course on, a certificate course on integrative medicine with yoga and Ayurveda together for psychiatric professionals. So which was again very productive. Many people joined, many people from outside the country also joined. Even the Royal College of Psychiatrists recently had a course or a symposium on spirituality in clinical care.
I believe you were the speaker there.
Yeah, so I'm just saying the interest is coming up.
Yeah.
I'm hoping that over time, I think we will practice an inclusive medicine. Integrative medicine may be, we are integrated. So there's nothing to say.
Yeah. Looking at the larger picture, sir, I mean, India is said to be the yoga capital of the world. Where do you think, what role can India play in the global mental health problems?
Yeah, we have the unique opportunity to use traditional inputs into mental health care. I am giving an example of yoga. Even mentioning yoga in the UN meeting made sure that it became a formal agenda. A International Day of Yoga was declared by the UN, United Nations. So India can point this out. And more recently, a study was conducted in immense as to the SDGs, how yoga can be an important ingredient to achieve all the SDGs, Sustainable Developmental Goals, and all related to mental health getting better. So my feeling is rather than depending only on psychiatrists, which of course psychiatrists have a role to play, but I think all other players who will benefit improving mental health should be exploited, and a major role could happen from yoga, and India can be the major spokesperson on this.
Right, sir. Sir, I mean, you've been associated with the National Medical Council. You've been like at the helm of it. What policy level changes do you think can...
The two things have happened in the National Medical Commission. Beginning steps.
Right.
Yoga has now been advised to be put into the foundation course for all MBBS students. One. And that should culminate in the International Yoga Day of mass yoga performance by all these people. This is number one. Foundation course to have a part of yoga. Second thing is, they have an elective posting in the what we call as internship of 12 months. 1 month they can take an elective posting. In elective posting, they will choose various departments. 1 week here, 1 week there. It's optional for them. And the last 2 years, we have also included exposure to Ayush systems of healthcare, whether it is Ayurveda or Yoga, if it is available in their institute or in their parent sister institutions. Students can avail that. So it has been made legitimate as part of the MBBS curriculum. And third most important point is the Act allows discussions between commissions. A National Medical Commission should discuss and also have meetings with the other commission, for example, Indian Systems of Medicine Commission, and evolve some protocols for educating doctors, students, and so on and so forth. So, Act has been made into this. It's a part of the National Medical Commission Act. So, I believe if this is harnessed over course of time, the speed of integration can be faster. Both us taking them and they taking us. So they and us will come together, and that me and me will probably become we. So it's a potential that can happen. Foundation has been laid in the Act, and we have to see how we are going to use it with the best spirit, which we should use it, the patient getting the benefit.
Yeah, that's the most important thing. The last person, the patient, should get the benefit. Sir, it's been a very engaging discussion that I've had over the last almost 1 hour, sir. I didn't realize how time flew. But let's just try to conclude on this note, sir. If someone who's listening to this podcast and he's having symptoms of depression or anxiety, what are some 2 or 3 lifestyle changes or yogic practices he can incorporate so that he, she, or they can get benefited out of this?
Yeah, some of the yoga practices for yoga, anxiety, depression, etc., we have already published. It's available on the net. It's a free downloadable things. If they go to the NIMHANS yoga department's website, they will get integrative medicine department. They'll get everything. That's not the point. More important thing is lifestyle changes that will include continue to remain active, avoid foods which are stale, avoid foods which are toxic, like I'm saying even alcohol, which is a stale food. It's a fermented. Of course, it is a stale food. So these are the things which I would recommend. Fresh food, freshly prepared food is best to eat, not fridge food which is maintained in the refrigerators and things like that. And physical activity as much as possible. If you cannot practice yoga, keep doing physical activity. and keep jumping, skipping, going to swim, jog, do whatever that is available to you. If yoga is available, do it. If somebody can teach you yoga. What are the yoga practices? Some of the practices that we have mentioned it in our modules that are there. And if you have already known, practice them. Make sure that your day-to-day routines are as much disciplined as possible. Long hours of watching screen, particularly after dusk, is a sure way of demoting sleep to happen. So some of these small things for depressives, it will be very helpful to practice.
Right. Very simple measures like sleep hygiene and taking care of your day-to-day activity, what we call behavioral activation. And, when these are things which we actually
sync with the nature, you're more likely to be natural.
Yeah. Very beautiful, sir. Thank you so much. Thank you so much for sparing time, sir, from your schedule. It was a very wonderful discussion. I'm sure the audience at large will get benefited out of this.
Thank you very much.